Hello everyone, happy evening, a very good evening. A quick nod whether the audio visual is all good. Am I audible and visible, anyone? Right, all right. So thank you so much, Aradhna, for those kind words, and I hope everybody is on physiology, completing the daily targets. I hope you have also watched the yesterday's video where I have spoken about 3 tips basically to complete your daily targets if you're finding it difficult to complete the daily targets, right? So today, this is the last part, I mean the second part of the pressure volume loops in the valvular diseases. We are now going to integrate with Wiggers diagram also, and we are going to see the effect of increase in preload, the increase in contractility, and the increase in afterload on the pressure volume loop. So basically these are graphs from the first aid USMLE book, right? Very, very important. Okay, the graphs from those book, from that book is very important. Okay. So the same question yesterday, like since we have discussed this topic yesterday, this is a question that I want to ask you. Tell me what valvular lesion is depicted here in this pressure volume loop. What do you think? Which valvular lesion is this? Absolutely right. I'm so glad to see all of you getting this right. Amazing. So you remember the tricks. So when you see that it is not thin, so this is not stenosis for sure. And you see that this line is going to the left. So this is mitral regurgitation, right? This is mitral regurgitation that we have here. Amazing. Okay, that's great. So everybody here, let's stay connected on Instagram, YouTube, Telegram group where I keep you posted of the upcoming classes, and also on an academy where there are a lot of classes that I take, right? So this is where we can stay connected. This is something that we have discussed already yesterday. Now, this is the part basically very, very important here in this graph. This is from your reference book, First Aid itself. So let's discuss what is the effect of the increase in preload, the increase in afterload, and the increase in contractility. Now this graph basically, which looks a bit complicated, let me simplify this for you. Now what do we have in this graph here is basically that, give me a minute so that, right, I hope the video is not obstructing the image now. All right. So the black color is basically the normal pressure volume loop. Okay, the black color is the normal pressure volume loop. And these colors that I have put, the green color, the respective blue color, and this brown orange color, whatever you want to call it. So tell me which one represents increase in preload. Is it the green color? Is it the blue or the orange? If you want, I'll just label it as basically, let me label it as A, B, and C. So what does A represent out of this? What does B represent and what does C represent, or the other way around? Tell me which graph represents increase in preload. Is it the graph A, that is this graph, or is it the graph B, that is blue color, or is it the graph C, which is the green color? Which one represents the increase in preload? The green color. Saiba, Yashika say it is green color. Why do you think it's a green color graph which is representing the increase in preload? The C one. So for this, we need to understand the concept of what is the preload and what is the afterload. Okay, the preload and the afterload basically. Okay, So this is, you can understand this with respect to the left ventricle. So remember that schematic diagram that we had in the day before yesterday's class. अगर ये left atrium है, left ventricle है, and it is going into the aorta, right? So these are the doors. Basically, you have here the mitral valve and you have the aortic valve. So preload is basically what is coming into the left ventricle. That is the preload. That is before the contraction, before the pumping of the blood out of the left ventricle, how much is coming. After load means uske baad, left ventricle ke baad jo aorta hai, so how much resistance is being provided by the aorta towards the outflow. Okay, so that is what it is. So imagine that this is the left atrium, the left ventricle and the aorta. So left atrium se left ventricle mein jo aa raha hai, that is the preload. The resistance offered by the aorta, that is the afterload. Aorta is present after the left ventricle. That is what the afterload is. So preload, when it increases, when the preload increases, that means a lot of blood is coming into the left ventricle. That means left ventricle is receiving a lot of blood from the left atrium. That is the increase in preload. If the inflow is more, so when I will open this tap, that is the aortic valve, the amount going into the aorta will also be more. So इसमें basically हमको क्या मिलेगा? What is increasing here? So the inflow that is happening into the left ventricle, let me erase this, okay? So the inflow that is happening into the left ventricle from the left atrium, that is increasing. So this inflow which is here, is it the end systolic volume or is it the end diastolic volume? The amount of blood received by the left ventricle from the left atrium, is it the end systolic volume or is it the end diastolic volume? So when the inflow is closing, the inflow is stopping, inflow happens during the diastole. So at the end of the diastole, what is there, right? So that is the end diastolic volume. How much is received in the diastole? That is the end diastolic volume. What is the end systolic volume? What is systole? The contraction, the blood going into the aorta. After the ejection, what is remaining? That is the end systolic volume, right? So basically, end diastolic volume is what is received by the left ventricle. End systolic volume is what is remaining in the left ventricle after the blood is being ejected out, right? And when you subtract the two, that is EDV, what was received minus what is remaining, is basically what the left ventricle has given, and that is called as stroke volume. The EDV minus the ESV, that is the stroke volume. Is this clear with everyone? Right, so end systolic, that means when the systole is ending, the ejection contraction is ending, what is remaining? That is the remaining wala. End diastolic is what is received. So when the preload is increasing, right, this is the left atrium, the left ventricle and the aorta. When the preload is increasing, that means the load coming from the left atrium is increasing. That means it is the increased amount of blood received. So what is increasing here is the end diastolic volume is increasing. If this is the pressure volume loop, this is the point A and this is the point B. Which one represents the end diastolic volume? Which one represents the end diastolic volume? It's point A and point B. Hello. Hi. Hi. Hello everyone. Dr. Nikita. अब चलो लॉग में गया क्या? चलो जल्दी. Hello everyone. So am I audible and visible now? I think now it has become like Kaira has to be there like the guest appearance in all the sessions. उसके बिना उसको मजा नहीं आता है. कहाँ थे हम? नहीं, रेखा ऑलरेडी भगा दिया उसको. चलो. So we were discussing about the increase in preload, the increase in afterload, and the contractility. So when the preload increases, so basically the amount of blood received by the left ventricle is more. So the end diastolic volume increases. Okay, so what represents the end diastolic volume is what we were talking about, point A and point B. This is the end diastolic volume and A is the end systolic volume. Okay. So that is why when there is preload increasing, the end diastolic is increasing. So the graph will go to the right or the graph will go to the left. Where is the graph going? Right, so the graph will go to the right. So basically increase in preload will cause the curve to shift to right. Right, because basically the end diastolic volume is increasing. So out of the graphs here, A, B and C, which is the one which is shifting to the right, this is the one which is to the right. So C represents the increase in preload, right? It is representing the increase in preload. And you can see that when the preload is increasing, basically the graph is becoming more wide. So the stroke volume will increase. Okay, the stroke volume will increase. That is why that is the graph showing increase in preload. Okay, which is the graph which is showing the increase in afterload? Now you have graph A and you have graph B. Which is the one which is showing the increase in afterload? See, so again, understanding this concept here, afterload basically means we said that left ventricle and then you have the aorta. Okay. So, no, increase in afterload. Afterload is what we are talking about. Why everybody is saying A या B दोनों ही options है. देखो afterload मतलब after the left ventricle comes the aorta. So if the resistance is increasing, that is the increase in afterload, right? So basically when the afterload increases, this is the left ventricle trying to push the blood into the aorta, but aorta is giving the resistance. So basically what will happen to the stroke volume when there is increase in afterload? The stroke volume will increase or the stroke volume will decrease, right? The peripheral vascular resistance is your afterload basically. So a lot of resistance is coming. That is why the blood going out to the stroke volume will decrease. Okay, the stroke volume will decrease. If the stroke volume is decreasing, that means something which is going out. So imagine that what is being received from the left atrium is the amount of money that you have earned. Let's say it is 100 rupees. What we are giving out into the aorta, that means basically the amount which is spent. Let's say it is 20. This is the amount which is earned. So basically what is remaining, okay, what is remaining will be 80. मेरे पास 100 रुपए है, 20 रुपए मैंने दे दिए, मेरे पास बचा 80 rupees, right? So this amount which is earned, basically that is the preload. Left ventricle has earned it from the left atrium. The amount which the left ventricle is spending, giving it to the aorta, spending, that is the stroke volume. And what is remaining is after spending, what is remaining, that is the end systolic volume, right? That is the end systolic volume. So here the stroke volume is decreasing when the afterload increases, right? So in that case, what will happen to the end systolic volume if the afterload is increasing? How much will be the end systolic volume? Will it increase or will it decrease? So basically aorta is saying no no no, don't spend on me, don't give me, it is like अगर आपने देखा हो कि कोई घर पे गेस्ट आ रहा है, कोई बच्चा आ रहा है, तो हाँ उसको हम बेसिकली 100 रुपए दे दो, 500 रुपए दे दो, जो भी है, it's like giving a blessing sort of thing, and the parents would be like नहीं 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 मत दो. So that is the resistance. so we are not spending. So basically what remains with us is more. ठीक है, दिल में तो बहुत खुशी होती है मन में कि हाँ अच्छा हुआ नहीं लिया देने के लिए तो हम बाहर से देते हैं, बट मन में बड़ी खुशी होगी कि हाँ अच्छा हुआ नहीं लिया. So that more remains with me. So basically the end systolic volume है ना, end systolic volume will decrease or increase. So what is remaining with me? Okay, what is remaining with me is increasing, right? The end systolic volume is increasing. Okay, so look at this one. So which is the graph basically? हाँ, और एओर्टिक प्रेशर क्या होगा बेसिकली जब आफ्टर लोड बढ़ रहा है. आफ्टर लोड मतलब जो प्रेशर आ रहा है एओर्टा से, दैट इज इंक्रीजिंग. सो एओर्टिक प्रेशर इंक्रीजेस, स्ट्रोक वॉल्यूम डिक्रीजेस, एंड सिस्टोलिक इंक्रीजेस, है ना. So this graph which you see where the pressure, the height of the graph is increasing, that means the aortic pressure is increasing. That is the afterload ka graph. You can see that here, this is the end systolic volume. What is happening to the end systolic volume going to the right? The end systolic volume is increasing. Look at this one, the width of the graph as compared to the normal, the stroke volume is decreasing. Can everybody appreciate that? So the graph has become thin. Stroke volume जो हम spend कर रहे हैं वो कम हो गया. So what is remaining? That is increased. So the end systolic volume goes towards the right. The pressure is increasing. So the height of the graph is increasing. Okay, the height of the graph is increasing. Is that clear with everyone? Okay. So finally this one, the graph A represents the increase in contractility. Okay, so this is the graph representing the increase in contractility. Now think logically and tell me, when the contractility increases, what will happen to the stroke volume? What will happen to the end systolic volume? Contractility क्या है? Contractility is basically देने का pressure. When the left ventricle contracts more, basically it is pumping out more. Contractility is contracting so much that you are giving out more. Spending is more. ठीक है? Yes, absolutely right, P. It is same as aortic stenosis. So basically जब contractility ज्यादा है तो जो blood which is going out, the stroke volume increases. What the left ventricle is spending, that increases. So if that increases, the spending is increasing. So what remains? The end systolic volume. My savings will decrease. Okay, the savings are decreased. So stroke volume increases. That means the PV loop will be wide or narrow. It will be wide. And the systolic volume is decreasing. That means where is the graph shifting? Where is the graph shifting? End systolic volume जो है हमारे PV loop में, this is the end systolic वाला. ठीक है, ये है हमारा यहाँ पे. एक मिनट. हाँ. So this is the graph basically here. This is the end systolic volume. This is the end diastolic volume. End systolic volume is decreasing. So where is the graph shifting? The graph is shifting to the left. Right नहीं, left. ठीक है, क्योंकि हमारा end systolic volume कम हो रहा है. End systolic volume ये पहले वाला है. Okay, this is the end systolic volume decreasing. So the graph is shifting to the left. Okay, you can see that the end diastolic volume is the same. The end diastolic volume is the same because what is being earned, that is the same. But spending more, so the savings are decreased. Okay, the graph is shifting to the left. Okay, the graph is shifting to the left. So preload mein, the graph is shifting to the right because preload is the earning, that is the filling which is happening. So it is the end diastolic volume increasing. Afterload mein end systolic volume decreasing. Okay, that is what we are seeing. And you have aortic stenosis. Now look at this graph, understand these points. So with increase in preload, basically the stroke volume is increasing, the end diastolic volume is increasing. Increase in afterload, aortic pressure increases, so the height increases. Stroke volume decreases, so the end systolic volume increases, right? So the graph is basically it is going towards the right. Okay, it's going, the end systolic volume is going towards right. Increased contractility, the spendings are more, the savings are less. End systolic volume is the saving. Okay, and the ejection fraction basically will be more because we are ejecting out more with increased contractility. Clear with everyone? Did you get this concept? The graph which looks scary, but actually it's very, very logical. Okay? Is this clear with everyone? Okay. Now, what we need to discuss here is the Wiggers diagram and the valvular lesions. How does it change in the valvular lesions? We are done with the pressure volume loop. Now, coming to the Wiggers diagram, I hope all of you remember this graph here. Basically, the highest pressure is the aortic pressure. Reaching till the aortic pressure is the left ventricular pressure, and सबसे नीचे is the left atrial pressure. I hope then you also remember the CO COCO and you remember the MAM. So this is closure of mitral valve, opening of aortic, closure of aortic, and opening of mitral valve. Okay, this is the basic. Now look at these graphs. Am I hiding any of these graphs? Let me see this. The four Wigger diagrams ka graph, and you have to match with the valvular lesions. Let me first see whether I'm hiding any part of it. Okay, not hiding. Now tell me which of these graphs represents aortic stenosis? Which of these graphs represents aortic stenosis? Aortic stenosis, aortic regurgitation, mitral stenosis, mitral regurgitation. So aortic stenosis is represented by which of the following graphs? Dreams, I'll come to your query when I come to that slide again. Okay? Which of these represents aortic stenosis? Absolutely right. It is the graph B. Why? Because let me zoom this image and show you. Now, the only graph, see what will happen in aortic stenosis. So, aortic stenosis is basically this left ventricle going to aorta. The door is very narrow. So, the left ventricle will have to increase the pressure more. ज़्यादा जोर से धक्का देना पड़ेगा. Will have to increase the pressure. जितना ज़्यादा कम narrow होगा door, we will have to increase the pressure more. So, the LV pressure will be more than the aortic pressure. So, that is what out of all these four graphs, A, B, C, D, the only one where you see this left ventricle ka pressure is going above the aortic pressure, that is aortic stenosis. In the rest, you can see that the maximum is reaching till the aortic. Here it is going above the aortic. So in aortic stenosis, basically the LV pressure is more than the aorta. So that is aortic stenosis. Okay, that is aortic stenosis. Okay. Now, apart from that, tell me which one represents aortic regurgitation. Which is the one which is representing aortic regurgitation? See what happens in aortic regurgitation. The left ventricle is pumping the blood into the aorta. The door should close, but the door is not closing. So the aorta ka blood comes back into the left ventricle. Okay, the aorta ka blood comes back into the left ventricle. So what will happen? The pressure in the aorta will decrease significantly, right? You have that water hammer pulse, a lot of signs. Aortic regurgitation we have discussed yesterday. Most important is remember the wide pulse pressure. So look at all the graphs here. Where do you have the wide pulse pressure? This is aorta ka pressure maximum or ये है aorta का minimum pressure. Look at the difference is significantly more, 120 और यहाँ पे 40. Look at this, the aortic pressure, the aortic pressure, the aortic pressure. It is somewhere like 120, 80, 70 वैसा है. यहाँ पे it is going significantly down, right? The falling of the pressure in the aorta is significant. It's going significantly down. So that is wide pulse pressure tells you that this is aortic regurgitation. That is what you need to remember. The remaining graph C and D, which is the one which is representing mitral stenosis, which is the one which is representing mitral stenosis out of C and D. See, it is similar to aortic stenosis, right? Absolutely, it is D. Jahan bhi the door will be narrow. So left atrium to left ventricle to aorta. If the door is narrow here, so this is mitral stenosis. If this door is narrow, so this is aortic stenosis. In mitral stenosis, the narrow door, the back pressure basically will cause increase in the left atrial pressure. Aortic stenosis, the narrow door, it is the increase in the left ventricle pressure. Right? That is what we saw. कि जब left ventricle का pressure ज़्यादा है, it is aortic stenosis. जब left atrial का pressure is more, then it is the left atrial pressure is increased, that is the mitral stenosis. Look at the normal left atrial pressure, the normal left atrial pressure, the normal left atrial pressure. Here it is like almost यहाँ पे 0 जैसा, 0 to 10 के बीच में. यहाँ it is at the level of like 30-40 के level पे है. That means the left atrial pressure is increased. Okay, it is throughout increased. So this is mitral stenosis. Clear with everyone? So this is mitral regurgitation, C wala graph. Can someone tell me why this is mitral regurgitation? It's already labeled यहाँ पे left atrial pressure तो ठीक है, but you can see that in the JVP or the left atrial pressure curve, this V wave that you are seeing here, it is tall. What does the V wave basically represent? We have discussed in day before yesterday's class. V wave is basically the venous return or the venous filling of the atrium. Here it is the left atrium. Okay, here it is the left atrium. So the left atrium normally should receive blood from the pulmonary veins. The blood received from the pulmonary veins, that forms the V wave. But here the left atrium is also receiving blood from the left ventricle. Why? Because there is mitral regurgitation. So the left ventricle ka blood is also being received by the left atrium. So the venous filling, the venous return is increased. That means there will be the prominent, the tall V wave. Sometimes it is also called as CV wave. Why? Because AC के बाद जो X descent आना चाहिए वो आता ही नहीं है. C combines with V. Okay, so that is CV. So remember the tall V wave is mitral regurgitation. So look at this JVP of tricuspid or regurgitation, which will be similar to mitral regurgitation. So you don't see the X descent, right? There is absent X descent because basically there is no relaxation. X is the relaxation of the atrium is not happening, right? So there is absent X descent. There is CV or the regurgitant wave that is there. And after that, the Y descent is rapid because so much of filling is happening in the atrium. It wants to empty soon. The Y descent is basically the emptying. The Y descent is rapid. Okay, the Y descent is rapid. Clear with everyone? So there is no X descent. You have the C and the V basically combining. The tall V wave, that is increased return from the mitral regurgitation. Okay. So quickly, let's see how much of this you remember of whatever we have discussed. कि कैसे कैसे identify कर रहा है. Wiggers diagram किसका कौन सा है? How will you identify basically? See the first one where the V wave is tall. V is the venous filling coming from the mitral regurgitation. So this is mitral regurgitation. What is the graph B representing? The large pulse pressure. The aorta का pressure is going significantly down, right? Start ruling out कि ये mitral regurgitation है, कि ये mitral stenosis है. Why this is now in the graph B? If I tell you why this is not mitral stenosis, how do you defend that this is not mitral stenosis? Mitral stenosis, the left atrium pressure should be high, but the left atrium pressure is at like 0 to 10 wala. This is normal. Mitral regurgitation, the V wave is not tall. Aortic stenosis, the left ventricle ka pressure is not high. But so what remains is aortic regurgitation, the large pulse pressure. This is aortic regurgitation. This one, the graph C. What is the graph C showing? Look at the left atrial pressure. It is high, right? Aapka 30-40 ke level mein. This is high. So basically this is mitral stenosis. Increased left atrial pressure, mitral stenosis. Increased left ventricle pressure, that is aortic stenosis. Okay? And this one, where you see the LV pressure, this is the left ventricle ka pressure going above the aorta ka pressure. So this is aortic stenosis. So mitral stenosis, mitral regurgitation, aortic regurgitation, and aortic stenosis. These are the only points that you need to remember. Tall V wave, LA pressure more, large pulse pressure, and the LV pressure is more. Okay? So these points will help you remember these. Now let us quickly, now these are your pages from the USMLE First Aid ka book. So this is what has been integrated. This covers your valvular lesions. So integrating physiology with medicine. In aortic stenosis, what happens to the left ventricle pressure? Increases, right? Because basically the door to the aorta that is decreased, left ventricle pressure increases, right? The aorta is not ready to receive the blood. So what remains with the ventricle? The end systolic volume increases, right? The stroke volume decreases. Basically, what is spent by the ventricle is decreased. Nothing is going out much. And because of the narrowing, there's a lot of hypertrophy, the back pressure causing the hypertrophy, and the ventricular compliance decreases. So the end diastolic pressure increases. So look at the graph here. Pressure volume loop. Stenosis is thin, shifted to the right, aortic stenosis. Okay. Stroke volume कम हो गया, and systolic volume बढ़ गया, going to the right. The pressure is increased, right? The pressure is increased. The left ventricle pressure is increased. Okay. Now the next one, aortic regurgitation, the wide pulse pressure. Aortic regurgitation means the increased stroke volume. Aorta means the shift to the right. So what is increasing here? What is increasing here? You have mild increase in the end systolic volume, and also the end diastolic volume is also increasing. Right? Both are increasing. The end diastolic volume is also increasing, and you have the stroke volume also, which is more. Okay? And remember, there is this loss of dicrotic notch because there is no closing which is happening in aortic regurgitation. Mitral stenosis, basically the LA pressure increases. Because the LA pressure is increasing, the door is narrow here. The filling which is coming into the left ventricle is decreased. So the end diastolic volume is basically decreasing. The end diastolic volume is decreasing. There is decrease in the end systolic volume. You can see the left shift, right? The left shift with the mitral lesion. So the end systolic volume decreases. The stroke volume decreases. Stenosis is thin, right? Stenosis is thin. Mitral regurgitation, again the shift to the left. That means the end systolic volume is decreasing, right? And regurgitation means wide, so the stroke volume is increasing. Okay, the stroke volume is increasing. What's happening to the end diastolic volume? The end diastolic volume is also increasing, right? क्योंकि ज्यादा ब्लड जा रहा है लेफ्ट एट्रियम में, वो लेफ्ट वेंट्रिकल में आ रहा है, तो एंड डायस्टोलिक वॉल्यूम भी बढ़ रहा है. So basically, if you see here in the regurgitant lesions, the stroke volume is more and the end diastolic volume is increasing. Okay, the end diastolic volume is increasing. Clear with everyone? Okay. Now the last question here, tell me what do you think will be answer to this? 72-year-old man has dyspnea and chest pain. On exam, there is 3/6 systolic ejection murmur. Between which points on the pressure volume loop does this murmur occur? So the points labeled here basically are 1, 2, 3, and 4. This is the second point here basically. If I have to redraw this diagram here, this is 1, 2, 3, and 4. Shift to the top, matlab. Let me come back to that image column after this. So 72-year-old dyspnea, chest pain, there is systolic ejection murmur. So which points on the pressure volume loop will you see this murmur? So basically first tell me what valvular lesion has been described here. What valvular lesion are we talking about in this patient? What valvular lesion are we talking in this patient? Elderly patient, whenever it's an elderly patient with dyspnea and chest pain, remember with old age, the aortic valve has the tendency to calcify. So that is causing aortic stenosis. The systolic ejection murmur. So it's basically telling you when the left ventricle is pushing into the aorta, ejecting, that is the time we are hearing the murmur. Why? Because basically the door is narrow. Whenever through the narrow pipe, narrow door, the blood will flow, water will flow, it will create sound. So the systolic ejection murmur tells you this is aortic stenosis. The term itself tells you it is ejection murmur. So basically between which points the ejection is occurring? Ejection में left ventricle का volume क्या होता है? What happens during ejection to the left ventricle volume? It is decreasing because it is pending, right? It is giving out. So this point where the volume of the left ventricle is decreasing, going from right to left, this is the ejection phase. So 0.3 to 0.4 is where you will see the aortic stenosis ka murmur. Okay, that is where you will see the aortic stenosis ka murmur. Where will you see mitral stenosis ka murmur? Mitral stenosis, the door becoming narrow from the left atrium to the left ventricle. When does the blood flow? During the diastole, the filling phase. Filling phase, matlab the volume increasing, that is points 1 to 2, right? So 3 to 4 is your aortic stenosis, 1 to 2 is your mitral stenosis. 2 to 3, this is your isovolumetric contraction phase. That is the point mitral regurgitation happens. The increase in the pressure sends the blood back to the left atrium. And this is the point where there will be aortic regurgitation. The aortic valve should close here, but it is not closing. So the blood going back, that's basically your early diastolic murmur, right? So aortic regurgitation will be 4 to 1 and the mitral regurgitation will be 2 to 3. Okay, 4 to 1 is your diastolic. Aortic regurgitation is an early diastolic murmur. Okay? Right, I think this completes our pressure volume loop and the Wiggers diagram. This is something that we discussed in the yesterday's class. कौन सा question था? Why it goes up? What was that question? Shift to the top मतलब किसका shift? Okay, never mind. So I hope everybody is clear with these concepts now, and you can revise this from the USMLE First Aid book as well. It is your page number 296, 297. So the Wiggers diagram, pressure volume loop, and the changes in the valvular lesions has been discussed with all the tricks. So make sure you write it down somewhere on a sticky note or somewhere and keep it with you so that you can revise it in the last minute. Okay? Thank you so much everyone for joining in. I'll see you again at 8 p.m. for the YouTube live session on the Unacademy channel, and it's gonna be about cerebellum. The layers, the function of the various cells, how there are these connections, climbing fibers, mossy fibers, how do you remember all of that is what we will be seeing in the 8 p.m. class. Okay? Thank you so much everyone and goodbye. Take care. Keep studying. Keep